Right. Hello and welcome to the WPS GHA webinar on medical review findings in outpatient rehabilitative therapy. And today we're focusing on progress notes. My name is Mary Sue Gardner, and I am a nurse on the Provider Outreach and Education Department. And I'm joined today by Rachel, who is one of the other nurses in Provider Outreach and Education. And she's going to be assisting me with the chat questions in the question and answer portion of today's call. Now, this is the second of a four-part series that I'm hosting this week on various components of therapy documentation issues. Should you find that you are unable to attend the other parts of this webinar, they will be posted in about a week to our YouTube page as encores from the live event. All right, on your screen and in the slide deck, if you downloaded the slide deck from WPSGHA.com, you'll see that we have the disclaimer on the screen. And our disclaimer basically says, we prepared this education in accordance with Medicare laws, rules, and regulations, but they often change. So it's your responsibility as a provider to make sure you are practicing within the current laws, rules, and regulation. We're going to provide responses based on these laws, rules, and regulations as they stand today. CMS also prohibits you from recording this event or taking screenshots for any profit-making purposes. So if you're doing that, we ask you to stop, and we are going to post this live event for you as an encore on our YouTube page. Next slide is just an acronyms list. These are common acronyms that I may say in any or all of the therapy presentations, so I just continue to reuse the acronyms list. So if I refer to an acronym and you don't know the meaning of it or don't understand what it is, you can just refer right back to this slide. All right. My overall objective for today is to help you learn about the medical review findings surrounding progress notes or progress reports, whichever way you want to call them, for outpatient therapy services. And we're specifically talking PT, OT, and SLP. I hope to achieve this today by reviewing with you the coverage criteria. We're going to discuss the essentials of documentation for progress notes. We're going to talk about some of those common findings that our medical review department sees and that other medical review entities like the CERT contractor or the RAC contractor see as well, so you can avoid those findings. As well as I'm going to give you some tips that may help you better document your overall progress notes. So these next couple slides appear in all of these therapy presentations. So if you listen to the educational event at the end of January and even the event that was hosted yesterday on evaluations and reevaluations, then you heard me talk about the rehab coverage criteria. Regardless of the place of service it's rendered, the coverage criteria are always formulated in the outpatient regulations. So this slide just points you to those regulations. And then those regulations also refer you to additional places of service, such as inpatient places of service, where you can find more specific regulations should that different place of service have them. So remember, if the place of service regulations are silent on a specific coverage criteria for therapy services, then you follow the regulations that are outlined in the outpatient therapy services, which is publication 100-02, the Benefit Policy Manual, Chapter 15, Sections 220 to 230. All right. Again, this is a review of the last couple of webinars that were hosted, but just to go over quickly and review the overall coverage criteria for the outpatient therapy services. So again, you're going to see this each day, but there are 4 basic coverage criteria for that exist for you to render outpatient therapy services. The first is a need-based service. So it needs you. It needs you, your licensure, your expertise as a therapist. So that patient needs you, and you need to practice within the scope of your license. It needs to be rendered under an established plan of care. And that plan of care and evaluation that we talked about yesterday needs to be established by the physician or non-physician practitioner or therapist. Now, generally, they're established by the therapist, but the regulations do say the physician or non-physician practitioner can establish a plan of care. So your care must relate directly and specifically to your plan. So if it's not identified in your plan, you shouldn't be treating it. Your care needs to be provided to the patient that is under the care of a physician. So services provided while under the care of a physician doesn't mean that that physician needs to order it, but that physician does need to certify it. And that leads to certification. So certification in and of itself helps to meet all of these other requirements listed above. Other things about certification, it must contain a legible, dated signature or the electronic equivalent. So for today's presentation, we're going to focus on the progress notes or progress report, which really support many of these requirements. It helps to show that you're working under your plan of care and that your services continue to be need-based. You can use your progress reports or progress notes to send for certification, which also supports that your services are being provided while under the care of a physician. So there's some general documentation requirements, again, for therapy services, and you'll see these in overall throughout the week, and those include your evaluation and plan of care and any necessary reevaluations that need to be done. Your certification and any necessary certifications, which helps to support their under the care of the physician. Progress notes and progress reports, including your discharge report, which is a documentation requirement, and then your daily treatment notes. So let's start talking about the overall coverage criteria for the progress report itself. Again, if you participated or listened to the encore of the general therapy presentation at the end of January, then you probably heard a little bit about the overall coverage criteria. Even if you did, this is a good time to review the Medicare requirements as far as progress reports or progress notes are concerned. In the interest of time, we're going to go through this a little bit quickly, but if you have questions, please be sure to place those in the chat, or if you're listening to the encore, you can place those questions into the YouTube comment sections or go back to the encore event from January. So progress reports are progress notes. The progress report provides justification of medical necessity of your treatment. As a therapist, this is your time to shine. So if you're placing most of your eggs into one basket, this should be the one that they are in. Your progress notes are used to compare the patient at the start of care and then at specific intervals of treatment so you can see the patient's progression towards the goals. The progress report must be written by the therapist or by the physician or non-physician practitioner, so no one less than you or the physician or non-physician practitioner. It cannot be written or formulated in any manner by the therapy assistant. This is because this is where it takes your knowledge, your skills, as a licensed therapist, your expertise to assess that patient, to describe their overall progression towards their goals. It's the time that you reassess goals, you make any changes if necessary. Sometimes if a significant change comes about in your patient, then it may warrant a reevaluation and new certification or recertification. So consider your progress report really an extension of your evaluation and your overall plan of care. The timing of the certification is on or before every 10th treatment day, or the timing of your progress report, I'm sorry, not certification, is on or before every 10th treatment day. So if you're coming due for a recertification, that doesn't affect the timing for your progress notes. You have to continue to complete those at least on or before every 10th treatment day. And you can complete progress notes as often as you wish, but in accordance with the regulations, they must be completed by the therapist at least every 10th treatment day. So again, just because you may have a recertification coming up, it doesn't mean that you need to change your progress note reporting at all. You can do them as often or as little as you want. And finally, a discharge note is required for each episode of care. So even if your patient happens to leave AMA, or they die, or they're admitted to a hospital and you don't even know it, and then maybe to a skilled nursing facility, if they move, whatever the case may be, if they don't return to therapy services, you are still required to complete a discharge progress report. This is your way as a therapist to wrap up the care that was delivered. So you would note where the patient was based on the last time you saw them. You would incorporate the information from the last treatments that were delivered, and you would explain in that note why the patient didn't return, if you know why they didn't return, or just the fact that they didn't return and here's where they were based on the last treatment. Now, the Medicare billing system is going to automatically close the episode of care after 90 days of no billing for that patient. But again, for documentation purposes, you have to have a discharge note of some kind. All right, so as we move on, let's talk about the content of the progress note. When writing a progress note, there's certain aspects of information that should be included in your documentation. So this includes an assessment of improvement, extent of progress, or maybe lack thereof if they're not making progress towards their goals. Again, document where they were and where they are. If there is no progress, and you're hoping to gain progress because of you're trying to rehabilitate them and this is not a maintenance program, then explain why. Why is there no progress? Are the goals unrealistic? Are the modalities of service too complex for this patient, etc.? Explain why they're stuck. Our patients will often plateau in therapy services. However, the thing that makes you unique to therapy as a therapist, you can pull out all your tips and tricks if you know this patient can get better and make changes to what you're going to do, make changes to those interventions to hopefully drive that person beyond that plateau. So that's the things that your therapist or that your reviewers are looking for. If your patient levels out and it just looks like you continue to do the same thing over and over again, we may deny your service. So use your progress report to the best of your ability and show us what you're doing, what skills you're pulling out of your hat to drive this patient forward. All right. Each progress reporting period, you should be looking at and noting that progression towards goals. And if you're not, again, do your goals need to be updated? Is there some sort of significant change in their functional status? Do you need to do a formal recertification? Do you need more time and treatment than was initially anticipated? If some of those things exist, it may be time also to maybe reevaluate that patient. So we talked about this yesterday during the initial evaluation, plan of care, and reevaluation. So again, think of the unanticipated, unexpected. If those things exist and you get to your progress report period and you're really, it's just not the patient you thought it was going to be, is there some sort of significant change that's going to warrant you to reevaluate your patient and then move them forward? I did see there was a question that came into the chat that asked, does a recertification qualify as a progress report or a progress note? You can use a recertification as a progress note. You can also use a progress note as a recertification, which is more likely what it is. You complete your progress note or your progress report. It has all your documentation towards goals, where you are, where they were, et cetera, and then you send that for your recertification. So as long as all the components exist, yes, whatever you send to the physician for recertification can serve as a progress note, and that progress note or the progress note can serve as a recertification. All right, finally on your screen, there's functional documentation. So although functional reporting is no longer a requirement in outpatient therapy services, you must still document the patient's functional progress. So documenting functional progress is really essential to justifying the continuation of treatment. Detailed notes should reflect how therapy is impacting that patient's ability to perform, their daily activities. All right, so as we go on, let's talk about the timing exceptions. So we talked about the rules surrounding the timing. And again, I said that's on or before every 10th treatment day. Now let's talk about some of those exceptions to the rules. So what happens if it's a progress report day and your patient doesn't show up? Maybe they're sick or they're on holiday or traveling. Well, it's not a treatment day. So then the progress report would just go to whatever the next treatment day is. Remember, progress reports are due on or before every 10th treatment day. That's the key, not calendar day. But what if it's the end of the episode of care? So we're not going to see this patient anymore, and it's like your discharge progress note. Well, like I said earlier, a discharge note is still required even if the patient doesn't return for whatever reason. So you would complete that note without the patient's active participation, and you would just note the fact that they did not return to your services for whatever reason, if you know what that reason is. There's also a provision in the regulations for delayed reports. Now, this is when there was some sort of unexpected absence by the clinician that delayed the timing of the report. So if this should happen, the therapist should complete the progress report within 7 calendar days of missing the report and document the reason the report was delayed by you, the therapist. So there must be some documented guidance to the therapy assistant if treatment is going to continue in your absence. That way the therapist can show the assistant continued to act under their guidance during that time. And this, again, this all would be an exception, not a norm. So try to make sure you're not missing progress notes. And if you do, make sure it's not on a routine basis. And don't rely on the exception to the rule to always cover you. That's not what the exception is for. It's for those onesie, twosie times that you're sick, the weather inhibited your ability to get to work, you had a baby unexpectedly, whatever the case may be. So you do have some provisions in the regs to cover you, but you should also cover the documentation by making sure the guidance is in your documentation, and you need to get it done and completed within 7 calendar days, and you need to tell us why it was missed. All right. So we talked a lot about the discharge note and discharge survey or summary, whatever you want to call it. So it should be no surprise that it is a required component of your documentation. But just to reiterate, the discharge note is required for each episode of care, regardless of how the patient left your services. So it covers from the last progress note to the time of discharge. There is an exception to writing the discharge progress report that it can be done early. And that is if you know a patient is discharging within 3 treatment days, you can complete your discharge progress note and then give guidance to the assistant on what should be done in the last 1 to 3 days of service. That way they have continued direction from you on what should be provided. And this would be very rare, like maybe if you were waiting for, you know, an assisted device to be delivered or something that your assistant could educate on very easily. And they're going to have to come back like for 1 or 2 more treatments, you know, and then they're going to be done. Honestly, I've never seen this within documentation, but there is a provision in the regs for that. All right. So what is your assistant's in the progress note or progress report itself? PTAs or OTAs or CODAs, speech language does not have assistants, but PTAs or OTAs by themselves cannot write a progress report. This again is because a progress report is an extension of your evaluation and plan of care and any necessary reevaluations, really. It's your way to show the patient's progress from the initial eval or from the last progress note, where they were at to where they currently are. This is when you assess your overall progress towards your goals. So it's not something that your assistant can do. However, we will allow for your assistant to give you information on how the patient has done while being treated by the assistant. And you can incorporate that into your assessment and progress note. So progress notes that appear to be formulated only by the assistant will not be considered valid and could result in a denial of your services. Now, I want you to use caution on how your daily treatment notes are labeled and that everything is not called a progress note. We've seen this before in providers' documentation. And when we go looking for the progress notes, we're seeing progress notes that appear that they're being done by assistants because everything is labeled a progress note. So then we may actually deny services saying the right person did not do the services. So use caution again when your assistants are documenting. The other thing that I want to reiterate is use caution when there are co-signatures or signatures. And we're going to talk about that in a little bit as well. But use caution on how it appears if there's two signatures on a progress report. Does it appear that that progress report was actually formulated by the actual therapist? So let's get into some of those common review findings. And again, we're going to go back to that signature part as well. So the first most common review finding that we see, remember when I said that progress reports must be completed on or before every 10th treatment day? Well, unfortunately, sometimes they're not. We often get documentation submitted and there's either no progress report or the progress report doesn't show comparisons to the evaluation or last progress report, so then it only actually looks like a daily note. And then we're going to consider that an error. So this error or omission, denial of this service could cause your overall claim to be denied, and we don't want for that to happen for you. So just remember that it's important that they're completed in the timely manner and that they have an actual comparison to the last progress note or to the evaluation, and that it is submitted with your documentation if a medical review entity requests it. Oops, went too fast. All right, progress reports that are completed by the assistant. So we've beat this dead horse a lot as well. And I don't think I can stress this any more than I already have, but yet it still remains a common finding in medical review. So remember, your assistants they can write an optional element for you. As a therapist, you can take that element and incorporate it in your progress notes. We often get the question, is it permissible for the assistant to write a progress report if the therapist co-signs it? And the answer to this is still no. This is still not permissible. So if your documentation contains two signatures, one being the assistant and one being the therapist, make sure that it is evident that the documentation was formulated, updated, etc., by that actual therapist. If you cannot guarantee that that it looks that way, you cannot guarantee that it's evident who formulated it, then I would suggest you don't include the assistant signature into that documentation at all. We often get reports and the first signature on it is whoever signed first, and that happens to be the therapy assistant because they put in their additional information first, and then the therapist gets it and puts their information, and it appears when you print it and submit it to us that the therapist's signature is actually a co-signature and that the assistant actually formulated it. Again, if that's the case, I cannot stress enough, you need to make some internal changes within your department. The easiest thing to do is, I always tell providers, print, if you have a case such as the one I just described, print a progress report. Take it to the newest person in the office and hand it to them and say, can you tell who formulated this, whose report this is? And if they can't, then probably your review entity cannot either. And so again, I highly suggest that you would then change maybe how you're documenting that, and maybe that if the assistant is giving you additional information to include in your progress report, that it maybe goes into a different part of the chart that your therapist can look at and incorporate that. All right, and then no discharge report. Again, we've talked about this several times, but it comes up as a common error. Discharge reports are a component of the progress report, and it must be completed with every episode of care, even if your patient leaves in some sort of unanticipated manner. So it's your responsibility as the therapist to take that information from the last progress report, incorporate any daily treatment information, and wrap up the episode of care by making that discharge report. And then finally, the last issue that we see is therapists not addressing the continued need for therapy services. So remember when we started today, and I said your progress notes is where it's your time to shine as a therapist. They're your time to show us how your patient is advancing or making achievements or progression towards your treatment goals. But what we also know as clinicians ourselves, that sometimes your patients, again, plateau in services. And if you're treating the patient and they have plateaued, then use your progress report to tell us what you're doing to get them past that plateau. How are you modifying modalities of service? Are you considering that some goals just may not be achievable in the manner in which you're trying to achieve them? So when you're writing your progress report, you should always be thinking to yourself, why does this patient still need my services? Then document why and what you're doing, what you're changing, what you're adding to get them to progress towards their goals. So again, when writing your progress report, two words, if you're going to take away anything today, objective and measurable. Always document in objective and measurable terms. Anytime you can give us a length, a weight, a percentage, a scale, a measurement of any type, it is only going to behoove you. If you ask yourself the question, why does this patient still need me and my licensure to be able to progress towards these goals, and you can't answer those questions, then perhaps they no longer need you or your skills or your license or your profession. So make sure that you are continuing to document why they need you, why they need skilled therapy services. One thing that sometimes we see in documentation is that the patient just does better when they're with therapy. Well, we would all do better if we were with a therapist on a daily basis. It's kind of like having a personal trainer. But generally, I don't need a therapist on a weekly basis. Do I need a trainer? Probably. It would probably, help me achieve some of my fitness goals. But, just because I do well with the therapist doesn't mean I need one. All right. So we're going to end with some tips for successful documentation of your progress notes. So a few things that we've stressed, re-stressed, and re-stressed again. Make sure that your progress note is completed by the actual therapist. And make sure it is done on or before every 10th treatment day. We just talked about how it needs to support that patient's need for continued treatment, because that is going to show us how the treatments that you're going to provide are going to help them progress towards their goals. And we want to see progression towards goals. Even if a patient is in a maintenance type program, you still have maintenance goals for them. They may not be making functional improvements, but you have goals, and we want to see that patient progressing towards the goals. Make sure your documentation also contains that discharge note, regardless of how the patient left, and make sure they are signed, dated, and credentialed. We need to know who did it, and we need to see the credentialing that they are actually the therapist that is licensed, or that they're the physician or non-physician practitioner. So we usually don't have any issues with legibility, but if you are still a facility that documents hard copy, paper documentation, make sure your documentation is legible. If someone in your office can't read it, that means someone in my office probably can't read it either. All right, so let's wrap up everything that we have gone over. Kind of a summary of today's event. My objective today was that you actually learned how to avoid some of these medical review findings in your documentation of progress notes. So we accomplished my objective today by reviewing that coverage criteria. We went over some of the documentation essentials and common findings, and then we also reviewed some tips to help you avoid these. Even if this is a review of information for you, it's still valuable because that comes right back to the forefront of your mind, and you know that when you are documenting, you're like, oh yeah, I gotta make sure that, you know, I'm still showing why it needs me, my skills, my license, my intervention. Okay. So at this time, I am going to pause and look over at the chat, and I do not see any questions in the chat at this time. So what I'm going to do is I'm going to continue on in the interest of time, but that doesn't mean you can't put questions into the chat. We will pause one more time at the end. If there are questions in the chat, we will answer them then. All right, I do see that a question came in. Can the progress note be written with the daily note if it contains all the required criteria, or does it need to be a separate document? And the answer to that is yes. It can be one document that includes your daily treatment as well as your progress report information. Make sure you are aware and of how it's labeled. You want to make sure it's evident that it is actually a progress report so it doesn't get missed if a reviewer should actually, you know, go looking for it. But yes, it can all be one document. It does not need to be two separate. So you can, it's basically like evaluate and treat. You can progress note and treat on the same day and incorporate them all into one document. And that is the last question that I see in the chat. All right. So again, if you have additional questions, please send those to us in the manner in which I discussed a little bit ago. But on behalf of provider outreach and education, as well as medical review, we want to thank you for taking part in this educational event. We look forward to your participation in future events as well. At this time, you may now disconnect.